G'day and welcome back to the channel. So in today's video, I want to show you how you can use a massage gun strategically to help improve lower back pain. And how I'd like to do this is we're obviously going to show you how to use the massage gun on your lower back to hopefully help relieve some of the symptoms that you may be dealing with. But like a lot of the things that I see clinically, if we just focus on where your pain is and where your symptoms might be, then we can very easily miss the bigger picture that helps us better understand why those symptoms are there in the first place. So not only are we going to do the obvious lower back massage with a massage gun, but we also need to go looking through other parts of your body for clues as to what might be contributing to that underlying back dysfunction. So let's get into it. Probably the most important piece of information to get across to you in a video about using massage guns to help treat pain and symptoms is that, like massage or acupuncture or dry needling, using a massage gun should only ever be considered a short-term symptomatic relief. The nature of most pain and injury is that pain and something like muscle tightness is very much a consequence of something else. And in the context of the lower back, that can mean a disc bulge, a nerve root that's getting irritated, an irritated joint, tissue that's overloaded, and your body and brain are recruiting muscular tissue and potentially also generating pain as a consequence of other things. So as I'm always trying to promote in my videos, we absolutely need to give you something that you feel is meaningful and helpful for your symptoms, obviously. But if we don't then pair it up with something broader, whether that be introducing mobility somewhere else, strength somewhere else, taking a strong look at the postures and the shapes that you get into the most throughout the day, looking at stress, sleep, diet, all of those other things, if we aren't considering you as more than just where your symptoms are, then we can very easily miss the bigger picture that helps us better understand what you absolutely need to improve to give yourself the best chance of your back pain going away and not coming back again in the future. But if you have your massage gun, the best and most obvious place to start is obviously the lower back. And in this instance, where we're going to basically be targeting with this is we know that either side of your spine, we have a group of muscles that run the length of your back all the way down to the top of your pelvis. Depending on whether the joints underneath or the tissue underneath are dysfunctional, those muscles can become tight and restricted in response. But as well as that, most people are aware of the QL muscle or the quadratus lumborum, which just sits underneath the level of your rib cage and runs down to the top of your pelvis, but out to the side a little bit more. The names don't matter for the purposes of this because we just want to base it on feel. And as I always try and promote in these videos, the only way that we know whether something has an impact and works for you is whether we base it on results. So what I would encourage you to do is before you turn on your massage gun, stand up, walk around, do the movements that you know reproduce your lower back symptoms, the ones that tell you how tight your back feels, how painful things are. Take a mental picture of how that feels, whether it's bending forwards, twisting, bending from side to side, going up and down stairs, putting your shoes on and off, it doesn't matter what it is. Do the thing that's meaningful for you first. Then we're going to go hunting for some dysfunction with the massage gun, and then I would ask that you immediately recheck those same activities or movements to see whether the areas that you were massaging with your massage gun have actually had an impact. If you don't see an immediate change in something, then nothing has changed. So please keep an eye on that and let me know in the comments down below afterwards what you feel this does for you. So getting into this, it's important that you start your massage gun at a level that feels very respectful, very simple. I'm going to do this on the lowest setting possible, and then you can make a very responsible, adult and mature decision about increasing the pressure or the speed if you feel that it's necessary for you. And when wanting to record a video on using a massage gun for low back pain, I was initially trying to figure out how I can get someone in as a dummy to do this onto, but ultimately it makes more sense for me to do it on myself, because if you are to do this on yourself, as awkward as this can be trying to get around the back, we sort of need to go through this together to get a sense of how this logistically will work for you. And I think one of the benefits of this massage gun in particular is it's not just one handle that has a fixed length that you can then dig into your own back. Because there's another part of this that I can grab onto, what I would suggest that you do is, if you can, sit on a chair and potentially lean forwards onto a kitchen bench or a kitchen table. If you're comfortable sitting on the floor, leaning forward on towards the bed. What you need to do is you do need to grab that massage gun and then aim to go either side of that spine. Now, obviously, if you can lean forward at the same time, what this does is by flexing your back, it opens up your back a little bit more. And if you have any muscular restrictions that are holding you back or contributing to your lower back pain, in a more flexed position, if you can tolerate it, will help give you better access to any of that dysfunction that you might find through your lower back. Now, I'm not sure if my voice is vibrating here on the mic, but the way that I would encourage you to use your massage gun isn't to just lightly let it roll around on the surface. What I want you to do is, shoulder flexibility permitting, make yourself comfortable, bend forward a little bit, just go down the side of your spine looking for something that feels a little bit thicker, a little bit tighter, potentially a little bit tender. But once you find that, we want to get you to put a little bit of pressure into that tissue and imagine that you're trying to grind that tissue free with the head of the massage gun. You don't have to push too hard, especially if you feel like this is tender for you. But by pushing the head of the massage gun in gently, while you sort of drag it through that muscular tightness, it can be a really great way to optimize the improvements that you can get by using this massage gun. You don't have to keep it on the one spot for too long, just some gentle pressure. You can come out to the side as well, you can come up and down, depending on what you feel comfortable doing and how flexible you feel and how comfortable you feel getting back there. Now, obviously, you can absolutely have someone do this to you, but with any pain and dysfunction, it's really important that you feel that you can take control of what you need to do to feel better, just so that you can do this whenever you feel you need it and you're not waiting for someone to either have the energy or the time to do this for you. But as I mentioned, if you can work up and down the sides of your spine, come out to the more lateral parts of your back, looking for that QL tightness or whatever muscular tightness you feel is there. Once you've spent 5-10 minutes working up and down each side, then immediately stand up or do the movement or activity that you did before that lets you know how your back was feeling. Do you feel any freer through your back? Do you feel like there's less pain? And as I said, if you don't feel something different from having this experience, then there's a good chance nothing has changed. But the next thing we want to do to try and help your lower back pain is we can use the same massage gun to go looking for and hopefully improve any restrictions through your hip flexors as they run up your thigh, come inside your hip bone, and anchor to the front of your lower back. Again, if your lower back around the back is where all your symptoms are, and you aren't taking the time to go looking around through the front of that hip, then you could be missing one of the handbrakes that's allowing your dysfunction to be there consistently. So when looking to use a massage gun to mobilize tight hip flexors, there's obviously a number of different positions that you can do it in. The classic one is obviously lying on your back, getting the massage gun into those hip flexors and trying to improve your function that way. But the way that I'd like to do it in this video is we can do this in like a high kneeling sort of lunge position where your leg is behind you. Now, obviously, if sitting is comfortable for you, please do it in sitting. If you're someone who can kneel down on the ground and do it this way, you are most welcome to. But if we can put your leg behind you, opening up those hip flexors, putting them on tension to begin with, then as soon as we get your massage gun over the top, we may then be able to make a bigger impact on that tightness than what we could in another position. And again, the way that I'd like you to think of this is, if you can find your hip bone at the front, the bony hip bone at the front, inside of that is the course of where those hip flexors tend to run. And they obviously run all the way down into the top of your thigh. And same thing that we did before, we want to get some gentle pressure onto that muscle, and we want to press in as we drag that massage gun along the course of those muscular tightnesses that you may feel. Now, obviously, as you come up next to that hip bone, you start working up towards your abdomen a little bit more. Be really gentle, be really respectful. Obviously, don't go too far into the middle. Don't come up too high. We're just looking to try and find any muscular restrictions that you feel may be contributing to the dysfunction that your lower back is feeling. But again, doing it in this extended position should give you better access to some of that muscular tightness and ultimately improve your ability to make change. And once again, once you've done that, stand up again, walk around, just see if your back suddenly feels a little bit looser and a little bit less symptomatic than it did before. Because we know clinically that if your hip flexors are tight, because they anchor to the front of your spine, they can very easily be one of the most missed components of lower back dysfunction. And then once you feel you've been able to find and hopefully release some of the tightness at the front of the hip, we can actually then go looking for some tightness at the back of that hip as well to see what impact that may be having from directly underneath your lower back. So when wanting to mobilize tight gluteal muscles to help your lower back function, you can absolutely do that in sitting if you feel that that is more comfortable for you. I just find that when you are lying down, because we obviously want to put your glutes under a little bit more tension to optimize this experience, I find that if you can rotate your leg over your opposite leg and just gently pull it up, almost to do that stereotypical sort of piriformis stretch, what this does allow us to do is it does give us good access into anything and everything that may feel tight at the back of your hip and also at the side of your hip as well. So as we did with the hip flexor mobility, we can just do the same approach. We just try and find exactly where you need to be with your massage gun. If you start right in the back pocket by potentially sort of twisting your leg over the side, start right in the middle, same deal, just dig it in there. Try and use the vibrations from the massage gun to assist you almost massaging that tissue away with the head of that massage gun. Start right centrally there, work in and around there, paying attention to anything that you feel is meaningful. And then once you feel like you can start to sense a little bit of that becoming less restricted or less tender, we can then work a little bit more around towards the side, more towards where your true gluteal muscles tend to be. These can obviously become tender and dysfunctional because you have lower back dysfunction, but it can be a vicious cycle where tightness and dysfunction that persists underneath your back can mechanically force more movement to go through your lower back than what your hip should generally allow. But again, looking for anything that feels a little bit tight and nasty for you, using the vibrations and the pressure from the massage gun to do the job for you. Now, if you are someone who deals with any sciatic pain down the back of your leg, if you can find the hip bone at the side of your hip, then immediately come backwards and then down towards the sort of butt crease a little bit more. In these areas are a lot of the deeper hip external rotators. That sciatic nerve either passes through these tissues or just adjacent to these tissues. So any restrictions that you may have developed in here can also cause some dysfunction to permeate down the leg. But same deal, just go looking for anything and everything that feels important to you, base it all off feel and just work on the spots that feel particularly the most uncomfortable and restricted for you. And then again, as I've been doing, immediately stand up and do the movements or the activities that you have been doing previously to gauge what impact, if any, this has had on you, to optimize how quickly you get better from this experience. But obviously, lower back pain can very easily feel complicated and insurmountable for some people. And clearly, just using a massage gun, albeit a very good one, just on its own, without adding in things like core strength, taking a look at your postural habits and shapes, mental health, fitness, diet, nutrition, sleep, stress. All of these things need to be factored into you as a person in order to understand clearly why you are where you are with your back pain. And again, if you are just thinking of your back pain as where your pain is, and you don't consider your back pain in the context of everything around it and other things it influences, then again, you can just be using a massage gun to no long-term benefit. But I hope those 3 techniques can help you find and improve some of the dysfunction that may be contributing to your lower back pain. As I mentioned, Bob and Brad were good enough to send me this D5 Pro massage gun. If you are in the market for a massage gun and you would like to purchase one, I'll leave a link in the description with a discount code attached. It is an affiliate link and it would be a big help to support the channel if you were to purchase one through that link. But as always, I genuinely hope that was helpful for you. Let me know by leaving a like on the video and subscribing to the channel if you do feel like this type of content is helpful and useful for you. But as always, good luck and I hope to see you in the next one.